Our Medicare message for today is to talk about the upcoming 2018 annual election period and how this relates to those of you who have a separate Part D prescription drug plan. As usual, your hosts are myself, Fanny Pacheco, and Kim Caldwell. We are both agents at our company, PBI Insurance, and for the last 10 years, we have dedicated our careers to providing healthcare solutions to seniors.
The annual election period, also known as the AEP, runs from October 15th through December 7th. Now, there are a number of things a Medicare eligible member can do during this period, but for the purposes of this video, we're going to address those of you who have a separate prescription drug plan, Part D. During the annual election period, you can assess your current Part D plan and make a change to move to another plan that will be effective for 2019. Now, we encounter a lot of resistance to making a change to another plan. Reasons for this resistance are that you may think you don't need to make a switch because your prescriptions have not changed, or you really like your current prescription insurance carrier and don't want the hassle of switching to another carrier. This video, again, serves to inform you that while you may not have to make any changes, it is always prudent to check. Here are some of the whys. Premiums, deductibles, and copays for your current plan can and will change from year to year. Costs of drugs and coverage rarely goes down each year, but the percentage of increase varies from insurance carrier or plan. This means what you pay currently for the exact same drugs will more than likely increase. But let's make sure the increase on your current plan isn't higher than any other plans out there.
Also, formularies for a particular drug plan may change. A formulary is the way in which a Part D plan catalogs the drugs it covers. Drugs are then additionally cataloged into tiers. Each tier has a different cost associated with it. A Tier 1 drug, for example, has a lower copay than a Tier 2 drug. A Tier 2 drug has lower copays than a Tier 3 drug, and so on. What we find happens each year is that some plans change these drug formularies, which can mean that a drug is no longer available under their plan, or drugs can be moved into higher tiers. A Tier 2 drug in 2018 may be moved to a Tier 3 drug for 2019. These changes can have a significant impact on the cost to you.
The pharmacy you go to also has an impact on how much you pay for your drugs. Each plan designates who their preferred pharmacies are for the year. Well, there's been a lot of movement in the prescription drug industry. Pharmacies are buying insurance carriers like CVS and SilverScript, and insurance companies are buying pharmacies like the United Healthcare and Express Script relationship. This can disrupt your existing costs because you might be used to going to a preferred pharmacy under your current plan, but in 2019, that pharmacy is no longer considered preferred by the plan, which means the cost of buying your prescriptions through that current plan will increase.
Where you live also impacts the cost of your plan. Your zip code may or may not be included in your plan for 2019. Part D insurance plan carriers enter and exit the market, not just by its state or metro area. They actually base plan costs on your zip code. If you have moved, you definitely want to check the costs associated with your new area. But also, it makes sense to ensure that your current plan is staying in your area and not having any cost increases.
Now that you're aware of why you should look at your prescription drug plan each year, here's what you should expect from your agent or broker. A communication going out to you in late September to get an updated list of your prescriptions as well as the current pharmacy you are using. Then in early October, they should run your list through Medicare.gov and get back to you with recommendations for a change if necessary. It is completely your choice to make any change. You can do absolutely nothing and let your current plan roll over to 2019, but you'll need to be aware that your costs will change. Saving a few dollars per month might not be worth the hassle to make the switch, but a couple $100s per year might make it worth it to you.
To make a switch, your agent or broker will send you an application for the new plan. That then gets submitted during the AEP. Once Medicare approves the application, effective 1/1/2019, you are now on the new plan with the best price for the most comprehensive coverage available for you.
We do this for all of our clients, but if for some reason you're not getting this level of service from your current agent, feel free to call or email either one of us directly, and we'll be more than happy to run your prescriptions and make recommendations for the upcoming 2019 coverage year. Thank you for listening.